have a unique opportunity to revisit with one of my good friends and a great friend of the practice, David DiMuzio. We wanted to kind of revisit where he's at now versus where he was, say, 5-6 years ago, and just give you as an example of what the permanency of this can look like.
I started losing my hair when I was 19 years old. I'm currently 40 years old, and by the time that I was about 25, I was really bald, close to a Norwood 5. Just essentially had the horseshoe bald top of my head kind of thing going on. And I looked way older than I really was. I would all the time be thought that to be 35, so around 10 years older than I actually was. And Dr. McGrath did a ton of work on me. I've had 2 surgeries with him, a little over 5,000 grafts, and it really has reframed my face. I think the thing that makes Dr. McGrath really exceptional is his artistry. And artistry is something that I think people don't think about enough when they're getting a hair transplant done, because it's not just a surgery where it's like, take something out, put it back in. It's really an art form, and having someone that can really design your hairline in a way that's going to complement you. I like my hairline now better than I even liked my hairline before I lost my hair. So, he's been able to really redesign an ideal hairline for me. And now I've been able to keep with the medical therapy, which he also formulated and compounded. I've been able to keep my hair as well. So it's really been completely life-changing.
There's a lot of patients out there that are very nervous and very uptight about the use of medication. They hear things and see things on the internet. And I try to sit with them, and it takes time. I have to explain to them that this is a false narrative, because we can custom tailor make the different doses of these medications to make sure that patients don't have any side effects and still get a benefit. Because forever, it's always been like a 1 milligram pill of finasteride. We don't always need to use 1 milligram. So many times, because I have the customization available, I'm able to start somebody maybe with a little lower dose. And that works beautifully. And then they get confident. They realize they're not going to have any trouble, not going to have any side effects, but they still will show benefit. And then we slowly are able to increase them and optimize them. But here's a great example of a patient that had, spent a lot of money and did a lot of work for his hair. And I don't want him to lose it. I want him to maintain what he has. And we found just the right formulation for him. And he's golden. And that's what we do with every patient. Every single patient. We try to optimize them with the right dose so that they don't have side effects and don't have to worry about that. This transplant that we did, it wasn't easy. David's got dark hair and he's got fair skin. And that always presents a bit of a challenge in terms of trying to establish a real sense of density. What's most important when we're trying to create a hairline that looks like this is, in the leading edge, we've really got to focus on creating a natural but dense look. And we do that mainly with just using single-haired grafts. That's what creates that natural transition through here. So it's not just me getting in there and creating a bunch of sites. There's a lot of thought and a lot of purposeful attention that is paid to being able to create something like this that looks so natural and has maintained for so many years. That comes with time, experience, and dedication to what you're doing. You can see that no one's going to look at David and say, oh my God, this guy's had a hair transplant. No, it looks very natural. It looks thick and full, and it fits his face. And those are the things we're looking for. Density, a natural appearance, and you know what? Pictures don't lie. This is where he is.
The thing I love about Dr. McGrath and his practice is that he really cares about helping patients. It's about getting patients the results that they want, not about doing surgery on patients. And so whatever the most effective way, and even the most cost-effective way, is that he can get them to that place, he's happy to do that. He's really a doctor, not just a cosmetic surgeon.